workers and practitioners, and we need to reconceptualize what this means for accountability work. So that's the first point to be made. The second point to be made, and sort of following from the first, is that research has to be, in my view, and collectively as COPASA, in service of supporting progressive allies at whatever level they're working in to inform their strategies for transformative change. This is a point that Jonathan has made several times. So not just what works for communities, that is really important. Research agendas need to be driven by activist priorities, but also research on how anti-accountability forces work to prevent systemic change. Looking at the accountability ecosystem, people have talked about structures within the global economy, how international forces are sort of setting agendas. We need research on the processes through which this happens so that we can identify ways in which this might be changed. The third thing from a research perspective is that this requires greater attention on our part as researchers to methods and methodologies. Yesterday in the plenary, the point was made that there's a hierarchy of methods dominated, from methods coming from the West that are very technical, that are not really, working with communities. Quantitative methods dominate, RCTs are the gold standard, etc. And I think what we need is sort of a pushback and a proliferation of work using alternative methods, mixed methods, methods that include accompanied research, participatory action research. And this onus is upon us to surface these methods and show how they're relevant, timely, and robust as well. So that's the third point. The fourth point relates to research agendas. I think we've already said that research agendas need to take into account priorities coming from the grassroots, but we also need to do two other things, or three other things. One is unpack the state. This has come up many times. We really need to unpack the state as an organization. It's not homogeneous, and it works in different ways in different contexts, and we need to really try and do some research to understand that. The second one is the private sector. It's already been mentioned, so I won't go there again. But I also want to point out that in many countries, I work in, more recently I've been working in places of fragility, conflict, violence, where the state isn't the main game in town. And there's a proliferation of actors, among which the private sector is just one of them. There are armed groups, there are religious organizations, traditional authorities. We don't talk about the accountabilities of these other actors, and we need to really start unpacking those. And finally, also global agendas, how they're set, what's happening at the international level, both in terms of the priorities that are being set, but also the funding that follows from those priorities. And the fifth and final point I want to make is that, we've talked a lot in this conference about the shrinking space for civil society. And I just want to also mention that the space for research is also shrinking simultaneously. Governments that are clamping down on civic organizations and mobilization, collective action, don't like research of the kind that is going to highlight these inequalities and the challenges that accountability faces. I'll give two quick examples. In Tanzania, a while ago, there was a law that says you couldn't publish anything that challenged government statistics. So, any research that contradicted anything that the government had promoted couldn't be published at all, and this is a challenge. In Myanmar and many other places, research permissions are being used to control what topics get researched. So you can't, for example, do some kinds of survey work or work with some minority marginalized communities, and yet market researchers or private firms can go out and do all kinds of surveys. So this is a big challenge. From the point of view of COPASA, I think we have a huge opportunity here because there's a myriad of experiences within COPASA, and together we can do some really interesting comparative work that both surfaces experiences but also enables some lesson learning and sharing across contexts. The point I want to make is that social accountability is not just about health systems or health service delivery. It's basically about politics, governance, democracy, etc. So we need to sort of promote that agenda, not just in health, but also in other services.
Thank you very much. And if we can have another round of applause. They've not only been very, very succinct, but they've brought out some very pointed and tough issues. I think it's been a very good panel so far. At this point, we have a whole packet of questions that have come from you. So keep those coming. I'm going to hand over to Renu, and she's going to bring out the first set of questions.
So thanks a lot. I think this was brilliant, the way you kick-started the discussions. And thanks also to all of you. We've got a whole flurry of questions, which I'm trying to read and see who they're addressed to. So we'll start with the questions. There are questions for everybody. I'm going to begin with Boryan first. And Boryan, you have drawn our attention to marginalizations of various kinds. And one question that we have is, and also this question which keeps coming up over and over again about community participation, and all of that. And linked to that, my question is that how do we work on accountability with the state when a lot of marginalization and exploitation also happens within marginalized groups? So what about the hierarchies which exist within communities, and how do we deal with some of that while we are moving forward on our agenda of social accountability for marginalized groups with the state and duty bearers? So if you could answer that question, then I will ask you a set of follow-on questions.
Thank you very much for the question, Renu. It's really a relevant question which we face with all the marginalized communities, and especially the marginalization and what I mentioned in the first day, when the oppressed become oppressors. And it's actually very difficult, and we can use different approaches. Because in our country, for example, we have witnessed that when someone from the Roma community becomes a parliamentarian or a minister or some civil servant, somehow becomes even another obstacle in accessing of Roma towards the services. Or there were specific services introduced, like Roma health mediators, to help them to access health services. And again, through our work on the field, we see that they just represent another obstacle. So instead of creating help, we're creating obstacle for the marginalized community to access services. I think it should be also, there are many these so-called community leaders or persons that are involved in different kind of activities, and people are afraid because of them to openly speak about some issues. That is why in our work we are trying to empower the genuine community representatives, not these false elites which got some position or some education and then become another obstacle. We're trying to empower the genuine community representatives, and together with pushing towards the government to involve these people empowered from the community in the processes of the policy making. Of course, it's not always easy and it's not always successful. There are going ups and downs in this process, but this is one of the approaches that we have used in our work. Still must very much work has to be done in order for this presence and involvement to be substantial and meaningful, because very often government representatives are using this just as a paravan, just as to show off that they have included the marginalized communities. But continuous pressure is needed in this regard.
Okay, thank you. There are some follow-on questions. When we talk about marginalized groups in Europe, what do you think we need to also consider refugees? So the question of refugees, and there's another particular group which is being talked about here, how to address inequalities amongst marginalized, excluding people, marginalization in the form of exclusion of people living along coastal mainland for generations without having a tribal status. So status of certain groups of people who are marginalized but are not counted as marginalized. So I think that's a generic sort of question. So if you could attempt those, and anyone else from amongst you, if you could attempt those.
I will address the issue of the refugee migrant in Europe, although it's more relevant for the countries in the European Union. My country is still not a member of the European Union, and we don't have much of the refugees. We're just transit zone. But still, it's a huge problem that Europe is facing. And in Europe, in the public health area and other areas, there are lots of discussion about the refugees and migrants. But I must say that I'm really sorry to convey this, but what I'm hearing from the public health experts in Europe is just how to treat the diseases of the migrants and how to protect their population, because they're mostly working on the communicable diseases of migrants, which is another discrimination. They do not talk much about the prevention or the non-communicable diseases or other factors that are affecting migrants. And now I cannot speak a lot because I said we are not members of the European Union, but still not much has been done on the inclusion, real inclusion of the migrants in the society. Maybe Germany is advancing at this point, but other countries not. And but really lots of work, and they should be treated as a marginalized group in Europe, of course.
Okay. All right, thank you. I'll move to Ariel now. There's a question which is to do with corruption. Since you spoke about corruption in Latin America, corruption has been identified as a barrier to accountability in health. How can we address corruption without bringing public services to a grinding halt in contexts where corruption is the norm throughout the system?
Without bringing public services
to a halt, threatening services for the marginalized people. You know, we are fighting corruption, but fighting corruption can result in an outcome where services can stop. So are there strategies? What are the strategies of working on corruption without threatening the interests of marginalized groups or of users?
I think here we need to talk about how do we create strategic alliances with some specific public actors that are also oriented on the anti-corruption system, which is still weak, unfortunately, in our countries. For example, in Puno, Peru, we have, and also in Guatemala, the alliance with the Ombudsman Office has helped them, helped these initiatives to address some issues that before couldn't be addressed. And we are talking about corruption and also mismanagement of health facilities. No? For example, just a quick example, in Puno, Peru, there was one facility that had only one provider. And that provider used to go drunk to the service. And sometimes the service was closed. With the citizen monitoring initiatives, indigenous women organized and the ombudsman made the claim, especially because there was a delivery that was given outside the facility because the guy was drunk and didn't want to work. No? So the guy was changed. Unfortunately, there was a team replacing this guy. The question that is embedded is, didn't the manager of the health network area didn't know the problems of this guy? Why he didn't act before? And he said it explicitly. He said, thanks to you, I have the excuse to take decision, because if I take the decision by myself, I'm going to be attacked by the union and all these things. So it's true that currently, I guess, in Latin America, there's a more sensitivity around the issue of corruption, but we still need to strengthen the institutionalization of our countries. Because what this problem of corruption has demonstrated is that the institutionality within Latin America is weak. And we need to move all the possible allies within the country in the different levels. We need to move public opinion, and we need to move, if possible, international allies. Because there's a problem also with international allies. In Latin America, most of the countries are coming to become middle income or middle high income countries, like India, like many countries in the world. And the problem is that before, there was like a wave of pro-governance and pro-accountability driven by donors. In this moment, some governments just say to donors, we don't care. Take your loan to other place. We are going to do the things with our resources, and we have resources. So there's a problem of an internal fight that needs to be made within the countries, within each country, with the best possible tools that we could have. And for that, we need research to highlight issues. For example, a research saying why laws are not being accomplished, how much time takes a law to be implemented when it's on behalf of the people or against the private sector. No? There's no research like that. Or things that could highlight these issues, because, as you say, the intention is not stopping the service. And for that, we need to put public opinion light on the actions that we take.
Okay, thank you. Masuma, would you like to respond to this? Yeah.
We've been engaged in some work a bit linked to that. And I think corruption is quite a big blanket term that we need to unpack. It happens at different levels in different levels in different ways. So if you look at the provider level, which kind of impacts directly on the users, what is corruption? It's a lot of informal practices, a whole pattern of informal practices. And I think it's really incredibly important to try to understand, why do providers engage in those informal practices? What are those underlying determinants and shortcomings of some of the national policies that are not being implemented? And also linked to the management practices. So I think it's very important looking at that. And we're coming up with a whole range of things, but again, in the constraints, what are some of the things that are doable?
Okay, yeah, Burian? Wow, this question's really getting a lot of discussion. Yeah, go ahead.
Very briefly on the corruption and the importance of fighting the corruption, especially the high-level corruption. Of course, the provider level corruption is important, but high-level corruption is actually what in the panel was said. Also similar, same for our country. Our ministry is moving from financing the health preventive program and cutting the budget for the health prevention and investing in the curative and buying expensive equipment, which is also linked to the corruption. Prevention is key. There is not much corruption in the prevention, but this is the key issue, because our funding and focus of our health sector should be on the prevention and not on treatment and diagnostic. But this is the influence of the corruption and also of the private sector and so on to this shift.